Good morning, good afternoon, good evening, wherever you are in the world. Thank you for joining us and watching this video today. We're going to focus on behaviour. So people who are living with a neurological and a neurocognitive disorder, there are multiple reasons why people may present with behaviour, behaviour that challenges. And I use the term behaviour that challenges because it is very often the problem of the caregiver, the doctors, the nurses, and the people around that individual, rather than the person themselves. So it's a behaviour that challenges everybody on the journey. And there are multiple factors that feed into why somebody may present with an unwanted behaviour that is challenging to us. Very often it will be regarded as the dementia, the condition, the disease is getting worse, and it's the disease that's causing this issue, this problem. But that isn't always the case. We have to look outside of that and look at the multiple reasons for it. Yesterday, I was scrolling through Instagram and looking at dementia-related issues, and somebody posted on Dementia UK a question about, what do I do when my mum says I want to go home? She could already be living at home, or she could be living in a memory care community or a nursing home or wherever she may be living, and she'll ask the question. Well, it's a complex answer. There's no simple answer to that question, but number one, we need to enter that person's reality. Validate the person's situation and belief system. Number two, we need to look behind the meaning of what that person is saying. So if somebody's saying to me, when am I going home? I want to go home. I want to look at what home means to that person. And usually, not always, I agree, but 9 times out of 10, usually, home means comfort, it means safety, it means security, it means I feel okay. We have a saying in the UK, and well, in England, an Englishman's home is his castle, because that's where we feel safe. That's our, that's where we go home to. We go to work, we go back, and we close the door, and we do our thing. So very often you need to look behind the message. And an example of this is, where is my mum? When is my mum coming to see me? Well, what we don't say, what we do not say is, well, you're 87 and your mother died like 20 years ago. We never say that. We don't go there. Instead, we validate that person's statement, and this is what we could do with that. What's your mum's name? Well, she's called Dorothy. Dorothy, that's my mum's name. Wow, what a coincidence. When you hang out with your mum, what kind of things do you do? Where do you go? Oh, we like to go shopping. Oh, that's cool, because so do we. I go shopping with my mum. And then sometimes we go and watch a movie. You do? What kind of movies do you like? Oh, we've always been James Bond fans. Really? Well, that is really cool, because I am also a James Bond fan. And I think I have some James Bond videos, DVDs, CDs, whatever we have today, Netflix. Do you want to watch it? Do you want to watch a James Bond movie with me? Oh yeah, that would be cool. So that's where you would go with something like that. You're validating the person's statement, you're validating their belief system, and whilst you are not totally and completely distracting from the actual question of when is my mum coming, where is my mum, you are actually distracting the person away from that anxiety and moving into a situation where the person feels calm, relaxed, safe, and getting into the movie and enjoying their time and spending their time with somebody, which is with you. So that is one example of how you would manage that kind of situation. We never confront people. We never get into an argument. We never get into a debate. If somebody's hallucinating and they say that they can see children in the corner of the room or a man standing over there, then we validate that belief. We don't confront by saying, well, there's nobody there. Don't be silly. Because that is a trigger for a more aggressive form of behavior. So always validating, always stepping into the world of that individual. Very often, that person cannot step into our world. So if Alice is living in 1972, we need to step into 1972 and not drag her kicking and screaming into 2024, because that's kind of fueling the behavior. If you look at the Nightingale dementia triangle, I talk about the two fuels that can exacerbate the symptoms of dementia. And those two fuels are anxiety and fear. So what we always have to think when we are engaging with somebody is think about dampening down the anxiety, dampening down the fear. And by validating a person's understanding and belief system, that is one of the ways in which we do it, as a best way of doing it, actually. And it's like if somebody says, which again is a typical thing for somebody with dementia, is they may see something on the bed, there might be things crawling on the bed, there might be something around there. The intervention, the engagement is to say, okay, yeah, well, let's leave the room and go outside and have a cup of tea or go for a walk or go and do something, and somebody will come in and deal with that situation. And then when you come back, it'll all be okay again. So you're validating the person's belief system and you're in their world. And it's very difficult. We talk a lot about empathy when we're supporting people through their journey. Empathy is one of the big things. But it's not always easy to be empathetic, because if we are not living in that world, we don't really understand it. We can understand it from an academic viewpoint. We can understand it from our experiences and what we've observed with other people and other patients. But we can't always live in that world because we haven't been there. So validation is key, absolutely key. And those examples that I've given will help you to support somebody who is presenting with a behaviour that challenges. Now, what if somebody is presenting with an aggressive form of behaviour? What if somebody is refusing to, I hate to use the word compliance because compliance seems like something you would do in prison, you know, it's a negative term. So what would you do if somebody is challenging you? Okay, well, again, we have to step into that world and try and understand why that person is challenging. Why are they becoming verbally or physically aggressive? I have a 5-minute rule. And your 5-minute rule is something you can implement if somebody is saying, no, I don't want to have a shower, no, I don't want to have a bath, no, I'm not going to eat this food, no, I'm not going here, no, I'm not doing this, no, I'm not taking this medication. Whatever it might be, step back for 5 minutes. Tell the individual, communicate, communication is key. I can see you're upset, so what I'm going to do, I'm going to step away for 5 minutes and then I'll come back and I'll see how you're doing. And make that 5 minutes 5 minutes, not 4 minutes, not 6 minutes, 5 minutes exactly. So do that, do your 5 minute, it's a 5-minute rule. And when you come back, very often the person has calmed down, is in a more understanding situation, position, and is ready to do whatever they need to be doing. If not, then we step back for another 5 minutes. There's no time on this. Don't force people, don't rush people, don't tell people we've got to do this now, we've got to have this done right away, we've got to do this minute. we can't do that. We can't put time restraints on people when they're feeling fragile. And remember, the issue is always linked to anxiety and fear. Okay? So remember that anxiety and fear is the thing that you are addressing. Okay, I'm going to stop and answer some of the questions that are coming through. So Lynn's here with me. Good morning, good afternoon, good evening, Lynn.
Good afternoon, good evening, good morning. So back to one of your other videos then, if you are on person-centered care, if you focus on the person and not tasks, being task-oriented, yes, it's good to have a routine and a schedule, and a person living with dementia is better, has a better day if they have some kind of a schedule, but you also have to be extremely flexible, correct?
Correct, absolutely. We kind of, whilst routine is really important, and it's always one of the things we stress that people should have a routine is not rigid. Nobody's routine is rigid, and nobody's routine is set in time scales. You know, what is the saying, mañana?
Mañana, tomorrow, yeah.
You know, there's time. Don't push people. Let them do things in their own time. And I know people working in the care sector, particularly in nursing homes in the UK, are going to say, well, we have time, we have to do this and we have to do that and we have to take this, we have to do this and this and this. A care plan should never be written with this must be done by this time. You know, a care plan is to be flexible, and we are looking at the individual, not the disease, not the problem. We should always be looking at the core strengths and focusing on those. So absolutely, flexibility is important, just like it is in all our lives.
And the frustration that a caregiver can have when trying to address behaviors that challenge, I would say maybe they need to relax and, like you said, validate, but they need to relax and understand that rationalizing with a person who isn't able to understand, you know, it doesn't mean they can't, it means they just don't understand what you're saying. So you have to put it in a way that makes sense, that they understand.
And last week, and the video hasn't been posted yet, so just an aside here, somebody is revamping the YouTube channel. It's all being linked to things, and work is being done on the YouTube channel by a colleague of mine. So things are happening with that. But last week I recorded a video about environment, and that'll be posted soon. Environment is something that is key to behaviour. We talked about that at the last video. So when you see that and link that environmental video to this video, you'll understand some of the importance of the environment, because the environment is key. The environment is really, really important to helping people remain calm. You know, play some music in the background, some nice relaxing music if somebody's agitated or frustrated. We've released a video about managing sundowning and reducing the risk of sundowning. Look at that video on YouTube. It's there on the channel. Look back a couple of weeks and you'll find that, and that's got lots of information as well about managing that kind of behavior. So please check those.
You were talking about some of the aggressive behaviors. So let's say you do the 5-minute rule and you come back and the person is, maybe their anger is elevated, their irritation, agitation. Is it fair to set some kind of boundary? Are you able to set a boundary with someone who may not understand what you're saying, such as if you threaten this, or if you throw that, or try to strike me, then, you know, how do you handle that?
Yeah, of course, there always has to be a time when enough is enough, of course. But if you follow through with those suggestions that I made and implement them consistently, then you will see an improvement in that behaviour. That there'll be an understanding between the two people or the parties involved in that situation. Eventually, it will become an understanding that, okay, if I behave this way, then what's going to happen is that person's going to go away. So eventually the understanding will develop, and the boundaries will develop themselves. It's not possible to say to somebody, right, this is it. If you do this 3 times, 3 strikes, and you're out. You know, we can't do that with somebody who has a cognitive impairment, and especially if they are so far along the journey. What we do have to do is understand the person's personality and character. So what was the person like before they developed a dementia type illness, before they developed Alzheimer's disease, vascular dementia, Lewy body dementia? What was their personality like? Because very often dementia will bring that personality and extend it a bit. So if people have always been, I don't know, short-tempered, impatient, aggressive, that kind of personality, then that's the kind of personality that they're bringing along with them on that journey. So it's for us to understand that, and it's for us to be able to work with that kind of personality. So think about those things, think about validation, think about managing the anxiety and the fear, dampening those things down, and really engaging with that person and going to where they are with them. Go with them, okay? So, is any more all done?
Yep.
Okay. Thank you guys for tuning in. I will see you in a little while. Have a fantastic day. Have an awesome week. And remember, dump the soda.